Marc Marquez injury update. His third freaking surgery. Will he even be ready for the 2021 season?
Bro, what are you talking about, man?
Hey interns, I'm Dr. Chris Raynor and I am not your everyday ortho. Today we're talking about the Marc Marquez injury update. Ollie Barstow of Crash recently reported on December 4th of 2020 that Marc Marquez had undergone a third operation on his fractured humerus. In this video, I'm going to go through the report and explain the findings in some more detail. I will explain why he needed another operation, the type of operation that was performed, what can be expected for his recovery, and most importantly, when he'll be back racing in MotoGP. And yo, if this topic is not for you, you can watch one of my other videos right here. I would appreciate if you support the channel and show the algorithm that you dig what I do. Otherwise, let's get to the topic at hand.
Ladies and gentlemen, can I please have your attention?
First, let's talk about the history. Marc Marquez suffered an injury to his right arm on July 19, 2020 at the Spanish GP in Jerez, Spain, the first event of the shortened 2020 MotoGP season. For more information on that injury, check out my video on that topic right here. Between July 19th and December 1st of 2020, Marquez had undergone 2 surgeries to treat his fracture, and he had been forced to sit out the entirety of the 2020 MotoGP season. The second surgery had been required since the initial implant failed after Marquez attempted to rehabilitate himself in an accelerated fashion after his initial surgery. In fact, Marquez had attempted to race only 2 weeks after his surgery, but found that he was not able to do so after riding in qualifying. After his second surgery, Honda stated in August that Marquez would be out until the end of October. Fast forward to mid-October. News had been circulating in the Spanish media that Marquez could be facing a third operation as a result of the healing process taking longer than expected. However, Lewis Duncan reported for Autosport on October 21st, 2020 that Honda confirmed that Marquez's recovery from his broken arm was proceeding as planned.
Really?
An HRC spokesperson reported, while it is a long and intense recovery, Marquez and those in his team have no cause for concern. Stefan Bradl continued to race for Marquez in his absence. But over the ensuing weeks, Marquez consulted with numerous surgeons to determine the best course of action. The last consultation occurred in Madrid on December 3rd of 2020. That same day, Marquez underwent a lengthy third operation on his arm. The operation was reported to have taken between 8 to 11 hours and was described as uneventful. The surgery was a collaborative effort between 5 different physicians. The procedure involved removal of the previous plate, the second plate, placement of a new, more robust plate, and augmentation with iliac crest bone graft and a cortico-periosteal free flap.
What'd you say?
What this means in plain English is that the old plate was removed and replaced with a longer, more robust stabilization plate. Active bone with vigorous healing potential was removed from the crest of his hip and placed at the fracture site underneath the plate to stimulate bone healing at that location. But if everything was going according to plan as stated by HRC, why was all of this necessary? Let's go over the clues. The third operation implies that Marquez was presenting with a delayed union. This is the term that describes a fracture that heals more slowly than expected. It can be seen on x-rays over time when the fracture line does not disappear as quickly as it should. It usually occurs between 2 to 6 months after the injury, but can extend even longer in some cases. If not treated appropriately, it can progress to a non-union where the fracture fails to heal entirely. Non-unions can be subdivided based on the presence of and the amount of healing, if any, that has occurred. There are several types of non-unions, of which the most important are atrophic, hypertrophic, and pseudarthrosis. Atrophic non-unions are those that show little evidence of healing at the fracture site. Hypertrophic non-unions, on the other hand, are those that show abundant evidence of attempted healing. Pseudarthroses are those that heal with fibrous tissue rather than bone. Marquez's physicians decided to intervene before his delayed union progressed to a non-union. Generally, when this is done, surgeons will revise the fracture fixation and they will treat the underlying problem that has prevented healing. So let's talk about the operation that was performed. In Marquez's lengthy operation, the surgeons removed vascularized bone from his hip, or in other words, bone that retained tissue that could provide a blood supply to the removed bone, and placed this bone at the fracture site. This lets us know that the delayed union was progressing towards an atrophic non-union. This type of non-union occurs when there is poor healing potential at the healing site. This may be caused by impaired blood supply to the bone fragments, metabolic causes like diabetes or smoking, or when soft tissues from around the site of injury have become trapped in between the bone fragments. This surgical approach also lets us know that his physicians suspected poor blood flow at the fracture site since they used a bone graft with a vascular flap attached. They hope to maximize blood flow at the fracture site with the transplanted bone. So it is likely that the cause of the third operation is different than the cause of the second operation. While the second operation was necessary because the fixation failed and the plate loosened, destabilizing the fracture site, the third operation was necessary because the fracture failed to show significant healing progress over time. Normally, in a young, healthy patient, healing would be expected to be relatively vigorous. With injury and a first operation in late July and a second operation 2 weeks later, we would normally expect his fracture to be fully healed by December of 2020. Incomplete healing at this time was indicative of some sort of problem that needed to be addressed. Honda released a statement reading, "Marc Marquez has undergone a new operation on his right arm as a result of the slow healing of the humerus bone, which has not improved with specific shockwave treatment. Today, the rider has undergone surgery at the Hospital Ruber Internacional in Madrid for a pseudarthrosis of the right humerus. The surgical procedure lasted for 8 hours and was uneventful." The overall length of the procedure speaks to the intricacy and delicacy of the procedure, even if it was uneventful. Sidebar. Shockwave is a passive treatment modality that is used to stimulate bone activity when bone healing is progressing slowly. End sidebar. His recovery? What about it? Following his third operation, Marquez is expected to recover over the next 6 months. Normally, in a young, healthy patient, I would expect this fracture to heal in about 6 to 10 weeks. However, in Marquez's case, we can expect this timeline to be extended to 3 or more months. Given that this is the third operation on his arm that has already suffered a loss of fixation, poor vascular flow, and a pseudarthrosis, it is likely that his physicians will take an extremely conservative approach to Marquez's rehabilitation after this surgery. I would expect Marquez to wear a functional brace on his arm as he has in the past, and I would anticipate that his physicians will expect to see significant healing at the fracture site before they allow Marquez to resume training exercises. They will certainly want to protect the vascularized pedicle attached to the bone graft. Early activity will jeopardize the connections of the delicate arterioles and veins attached to the transplanted bone. If that happens, we are back to square one, or should I say maybe square three, because like he had 3 operations. Hopefully for Marquez, the third time is the charm. And most importantly, when will Marquez be back racing again in MotoGP? With the recovery expected to last up to 6 months, he is likely to not be ready for the start of the 2021 season that begins on March 28, 2001 at the Qatar Grand Prix. Lewis Duncan reports that Andrea Dovizioso, on sabbatical after quitting Ducati, may be called upon at the beginning of the 2021 season to fill in for Marquez until he is physically cleared to return to racing. Given the suggested timeline, it may be closer to May or even June 2021 before we see Marquez campaigning in MotoGP again. Having worked with MotoGP and World Superbike physicians in the past, I can personally attest to how hard it is to keep professional riders off the track long enough to allow their injuries to heal. With one bad decision and a spate of complications and surgeries behind him, Marquez's physicians will be sure to counsel slow progress. As in racing, slow is smooth and smooth is fast. If you have another athlete who has suffered an injury that you want me to cover, share this video on social media and DM me on my social. I will pick my next topic from those DMs and tag you when it drops. If you like this video, then subscribe to the channel and become a part of the Intern Army. Hit the notification bell so that you don't miss any of my weekly content. And be sure to tag someone who is interested in medical topics. And of course, don't forget to follow me on my socials. Thanks for watching, and I'll see you for rounds next week. And as always, that's been a word from Dr. Chris, not your everyday ortho.
Just a flesh wound.